Imagine your dog's having a seizure and you're told it's just his stroke. But what if it's not true and something much more serious is happening inside? It all started when my friend who lives in Australia was telling me that he has a dog in Paraguay. She's in Australia and I'm in Paraguay. Her family is here and she was contacting me because she's very worried about her dog over here. So her family is here. Her family contacted me first and they were telling me that their 4 years old Labrador was having a seizure and the veterinarian was telling them it's just a heat stroke. But here's the problem. He lives in an environment where it's always air conditioning, and another thing is not that hot right now in Paraguay. So we started to analyze the case. They ran some tests with the veterinarian, and the blood work was shocking me. The liver enzymes was so altered. The whole test was altered. So I started to asking them what is happening, and the thing is, they just say it was the veterinarian says it's just epilepsy, but why? Like, what is happening? So they were telling me that he's having a treatment for leishmaniasis, which is a parasite who lives inside the blood cells. So they ran one quick test and they started to treat for leishmaniasis. For I thought it was a 2 or 3 month, but what really shocking me, it was that they're being treating the dog for leishmaniasis about one quick test for a year. They didn't make sure it was real leishmaniasis. So what happened was after a year of treatment, they ran the test again. And what really shocked me, like, what is happening here? They were told he has no leishmaniasis, and out of the blue, they have to start a new treatment for another disease instead of leishmaniasis. All of the sudden, they have to change everything. They suddenly stop the treatment with allopurinol and another medications, and they start to make another treatment for another disease. I after that I decided like I'm gonna analyze this case because it's gonna be like online consult, and I told them to make a video call, and we ran the video call, and I thought it was just with the mom, but the whole family it was so worried about that dog. In the call it was the mom, the sister, and the brother, and all of them around the dog. It was so emotional. They started to tell me, they started this story telling me that they were doing everything that the veterinarian telling them to do, which is exactly what everybody will do. So they started the medication. The seizure start after the whole medication, and they were telling me that it. I thought it was. Remember that I told you that I thought it was just 2 or 3 months ago that they started the leishmaniasis treatment. No, it was a year. For a year, the dog was having this treatment for leishmaniasis, which is not the case. It wasn't a problem at all. It maybe was a secondary infection, but they started treatment for a year and the liver was suffering. The test result was shocking me, as I said before. After they told me that, we start to analyze the case, and I have to speak with them like a long time, like maybe 1.5 hours. And they also say that there was like environmental issues because the seizure wasn't just the seizure is just the top of the problem. The liver was having toxins going to the brain and then it started to seizure. But this is like something more serious happening inside, as I say, and he has like acute liver failure, almost failure. So we have to start a treatment like for the whole environment and everything. They were telling me that the veterinarian didn't tell them, didn't explain well, and they prefer mine explanation. I started to tell them that we have to start with to regret it to go against the liver failure and start to recover from the environment and naturally with the medication because I can't just stop giving the dog the medication. They started to call and told me that there were toads, that the dog was running and biting those toads like frogs, and he was biting like it's happening like 2 or 3 times a month, and that's so worrying. That's very, you have to take that like very carefully because frogs, if your dog is biting frogs, some frogs skin have toxins, so when the dog bites the frogs, it activates those toxins. And if it's happening like once a year, it's fine. But if it's happening like very often, it can get inside and cause failure, liver failures as well. So they were telling me, and then I told them that this totally changed the case. But from the start, they ran this quick test for leishmaniasis, and after a year of treatment, what causes the seizure? It was the toxins in the liver. And what causes that was what? The medication. The medication that what they were told to do for a year. And I was so sad. It was so sad that the cause it was because of the medication. So another medication or treatment, and it was like 6 medications, and I'm not against the medication, but I'm not sure if it's like all that like we having this acute failure, liver failure, and like more medication can help. No, and 3 of them, like they were like 6 medication, and 3 of them were good, and 3 of them it was like against the treatment, and I didn't stop the medication. We just started like naturally. I gave them like recipes for liver recovery. It was like a chicken rice, then liver as well, and then some veggies. If you want those, if you want a video about the liver recovery recipe, I can do it as well. And I gave to them in PDF so they can do it. So we started naturally. We start with not taking off all the medications. It was like progressively, and they start telling me that they were going like too many veterinarians and they were always giving them like medications, and the dog didn't have any recovery signs. It's always getting worse. So we changed everything, and the approach was to go against the liver failure, because what happened with liver, thankfully the liver can recover and it can generate if we help it. How we can help with natural remedies and with no much protein, with special treatment, and with a special natural medication, special diets. And so we started with progressively going. they were giving them like 3 times a day. The dog, it was like a little fat. We're gonna give them food just 2 times a day, and we're gonna start with curcumin as well. Just a teaspoon of curcumin in the dog food, and then the recipe that I gave them. And after that, they were like so excited about the treatment because the veterinarian didn't explain them. And I was so happy to help them as well. If your dog has seizure, don't just assume it's just epilepsy, because the real problem can be hidden. And if you catch it early, you can save their life. Please subscribe if you liked the video, and don't forget to smash this like button. Thanks for watching this video.